to be seen on the recording. Next slide, please. So what we're going to be doing today is we're going to be hearing from the manager for the orthopedics and acute medical surgical unit, which is Marla Melgoza. And then we're going to be hearing from Suzanne Smith, the manager of the operating room. Next, we will be hearing from Meg Cordes and Melanie Tuamoheloa, the managers from the Bellevue Medical Center Med-Surg unit. And then finally, Erin Jordan will be speaking about the nurse residency program at Nebraska Medicine for our new graduate nurses. And then at the end, we'll have some time for questions. So if you have questions throughout the presentation, please go ahead and put it in the Q&A function through Zoom. And if you have any comments about the presentations, you can go ahead and put those through the chat. Next slide. I just wanted to start out today talking about our values. The culture and our values at Nebraska Medicine are really important to the organization and to all the employees who work here. And so all of the values we kind of start each meeting with, and you can see them enacted on all of the units at Nebraska Medicine. We use the acronym I TEACH, which stands for innovation, teamwork, excellence, accountability, courage, healing. And with that, we will go ahead and let Marla speak about orthopedics and her med-surg unit.
All right, good morning. So again, I'm Marla Melgoza. I'm the manager of the Med-Surg Ortho floor at Nebraska Medicine. It's on the 4th and 5th floor of the Lead Transplant Center. You can go to next slide. So here's just a brief overview of the leadership model on my unit. I have 4 supervisors. There's 2 on day shift and 2 on night shift. They all have their own direct reports, so about 20 nurses and CNAs fall under each one of those. And then I also have some support from lead nurses. I have a lead nurse on each day in addition to 1 supervisor. I have Ashley and Ellison as my leads, and then my nurse professional development specialist is Stephanie Kausgaard. They're just a really great team. They're a very strong team. A lot of them have been within the same unit for over 10 years and even some up to 25 to 30 years on the ortho floor. So lots of experience and great knowledge from the team. So the physical layout of 4 and 5 leads. So we are a 40-bed unit. Again, it's located on 2 floors just because of the physicality of it. We have 20 beds on 4th floor, 20 beds on 5th floor. They're all private rooms. The units look pretty much exactly the same. There's a centralized nurses station in the middle, and then 4th floor is unique because it has our physical therapy and occupational therapy room for our ortho patients. So they bring them down there. There is practice stairs they can do. They even have like a practice car that they can get in and out of to make sure that they're safe and ready to go home. Next slide. So the patient population, I would say we have anywhere from 60 to 70% are true, like your med-surg medical patients. They come in for all sorts of different things: infections, pneumonia, chronic kidney disease, diabetes, GI bleeds, some behavioral health, admits as well. They come from either direct admits from the ED. They come from all over Nebraska, depending on what their needs are. And then also from the ICUs once they get stabilized enough to come to a med-surg unit. And then we have about 30 to 40% of our ortho patients. So these patients come in to receive total joints. We do knees, hips, shoulders, minor spines. But then we also have our complicated joints. So those are kind of the ones that come from all over. If they have some complicated joints, or sometimes they're septic joints and they need to take out the ortho joints and put spacers in, do antibiotics, etc. These patients are kind of a unique population because a lot of them come in and this is planned. So they get lots of education prior to coming in. They're well prepared. They kind of have their regimen down and know it's coming. And they're here for about a day or two at the most. We do just serve the adult population. And again, it's just a variety of acute and chronic conditions. Length of stay can range from 1 day to weeks, depending on what their needs are. And again, a variety of dependent versus independent patients. You can go to next slide, please. So orientation and ratios, a lot of new grads are interested in the orientation process. So we have recently switched over to a little bit different model than what's typically used. And I believe this is used throughout the organization, but we do 2 weeks of 8-hour shifts. And that's really just to integrate you more within the unit. You get to meet more people. You're doing the same thing again and again, which helps kind of get those tasks ingrained in your head. And then after 2 weeks, you switch to the normal 12-hour shifts. We've gotten really positive feedback from the nurses that have went through it this way. We do weekly progress meetings with your supervisor, myself, your preceptor. And then we also have a nurse residency program and fellowship, which Erin will talk about later in the presentation. Ratios on our med-surg unit, they range from days are about 4 to 5. We ideally want to keep it at 4. And then nights are about 5 to 6 patients. And again, I have 2 leads on days and 1 at night that also provides support. And then I have 6 CNAs that help out through the day. And I have about 4 to 5 that work on the night shift. Next slide. So opportunities for growth. Nebraska medicine in general has just a ton of opportunities, but even on our own unit, we have some opportunities for growth and professional development. We have a unit-based council that has opportunities to be a chair and co-chair. So you can lead that meeting, send out the meeting minutes, organize. We also have a quality team that is unit-based. So again, they go to the quality meeting throughout the organization and report back, and then also talk about unit-based quality initiatives. There's a ton of opportunities to be on hospital-wide committees and work groups. There's always opportunities to advance once you're on the unit for a while to be relief lead and then eventually lead or supervisor if that's your goal. You can be a preceptor to new nurses that come in, and you can also be a preceptor to the students from the colleges as well. Next slide. So the culture, I won't touch base on this a whole lot since I already talked about it, but we really do ingrain the I teach values in everything we do on the unit. You'll hear a lot about it during your shift. Even we do MVP of the shift and talk about, who showed excellence during the shift or teamwork. We have a peer tree where coworkers can recognize each other for different areas of the I teach values. Team member of the month, social outings, hopefully more now that COVID is calming down, but holiday parties, we have a who's who board that recognizes nurses and more of what they're interested in outside of work. And then Nurses Week celebrations, we really make that a big deal on our unit and have all sorts of fun things. Next slide, please. So 4 and 5 lead, I think obviously I'm a little biased, but I think it's just such a great unit. We really do have such a wide variety of experience on the unit as well. I have nurses that are brand new at 6 months to a year, and I have nurses that have worked in the med-surg ortho unit I have a nurse that's been there 42 years. So definitely lots of experience, a lot of support, resources. They're a fun team that like to get together and have fun, go on vacations together, and just a variety of experience as far as the patients go as well. There's always something different every single day. You'll constantly be learning. So that's definitely a positive about 4 and 5 lead. Next slide. And then this is just my contact information. If you have any additional questions or just want to talk about the unit or get any more information, that is my email address and my phone number. So feel free to reach out if you have any questions. Thank you. Oh, and here's just some fun pictures from the unit. We had Nurses Week. There's days that you dress up, and then some of my night shift team down there in the right-hand corner. So just a fun group. So I believe that is the end of the presentation. Thank you.
Thank you so much, Marla. That was fantastic.
Next up, we have Suzanne Smith, and she is the manager of the operating room. And I will let her speak about her department.
Good morning, everyone. My name is Suzanne, and I am the manager for the operating room. I have been with Nebraska Medicine going on 18 years. Love, love, love our environment, our education, and our branching out, doing innovative procedures in the OR and outside of the OR. So a little bit about our operating room. Hickson Lead and the Buffett OR is comprised of 28 operating rooms. 6 of the operating rooms are dedicated to surgical oncology at our Buffett Cancer Hospital. The OR overall is a very thriving, busy environment. We hit the ground running every morning, and we are a big department. We're a big group of people comprised of about 170 employees, ranging from nurses to our CNAs, respiratory therapists, our cleaning service, surgical technologists. We are made up of a team-based service lines, and teams include RNs and surgical technologists who are highly specialized in their teams. So let me tell you a little bit more about these teams. We have 8 service lines, and some of them are combined according to their sister teams, we call them. So our first one I'd like to talk about is our cardiothoracic and our vascular team. We do innovative and very complex heart surgery at Nebraska Medicine. We also are starting, for the last several years, we have 3 hybrid rooms, and this is a collaboration between interventional radiology, the OR, also in cardiology, where we have started to do more and more of our cardiac procedures that are less invasive. Very, very exciting. So we are also a very busy heart transplant center and a lung transplant center. Some of the other innovative things we do in our heart team are heart assist programs where we do LVADs. We're pretty well known for that, and that keeps us very busy. It's very, very rewarding to see our very sick cardiac patients receive a new heart, a lung, and get these heart assist devices that really just transform their lives. So another team that's very busy in our OR that you could be a part of is our orthopedic team. We do lots of total joint surgeries from shoulders, hips, and knees, as you guys have already heard about. We also do a lot of ortho traumas. Those can come in at any time in the day or night, and that keeps us pretty busy as well. Some of our innovations that we've been working with is we have a new robot that assists with orthopedic surgery. That's very exciting for us. And if you love power tools, this is the team for you. Another very busy team for the OR is our neurosurgery team. And here we do complex neurosurgeries that deal with brain tumors, aneurysms to complex spines, along with our neurotrauma cases. Again, these can come in any time of the day or night and keeps us hopping. One of the things we're really proud about lately is our surgical oncology cases. I referenced this a little bit earlier. We have 6 ORs that are dedicated to our surgical oncology patients in our Buffett Cancer Center. These cases range from thoracic to head and neck, GYN cases. We also do a lot of free flops in our oncology center. Again, it's very, very rewarding to see our patients that are so sick and come in from all areas of our region to Nebraska Medicine to receive these very specialized surgeries. Nebraska Medicine and the OR have 3 Da Vinci robots, And this is an expanding area for the OR. We started off with one, and we recently just got our third robot. We are going in the direction of doing more and more of our cases through the robots, which is very innovative, very satisfying for our patients, more minimal incisions, which everyone loves. So this has been a very great opportunity for us as well. We are getting more and more of our cutting edge technology to perform the state-of-the-art surgery. Another team that you could be joining us is our GYN urology team. This team does lots of robotic surgery as well, and we consider them our robot experts. They can handle anything from tumors to prostate surgery, and it's very cool to see. We have big monitors in our OR, which allow everyone to view cases that are ongoing that a surgeon can only see from his 2 consoles. So it's very eye-opening to be able to watch and just see exactly what the surgeon is seeing. Finally, another service that is a very busy service and we're very proud of is our general transplant team. And I would describe this team as the meat and potatoes for the OR. This is where new staff coming in learn the basics of the principles for the operating room. And they, again, do anything from small cases to general surgeries to complex abdominal cases. We do a lot of laparoscopic surgeries. We do bariatric surgeries. And finally, we do a lot of transplants on our general team. We do kidney, pancreas, small bowel, and livers. Nebraska Medicine is well known for its liver transplant center, and we are so happy to help all those patients. Finally, one of the teams that everyone participates in is we are a level 1 trauma center. And so when traumas come to the OR, we all band together. Sometimes it's all hands on deck, and all staff can participate in our emergent trauma cases. Depending on what comes through the doors, it could be all the hands on deck type of thing. And we're very happy and very moved to take care of these critically injured patients that we see. So finally, our leadership in the OR is comprised of a manager. I have 6 supervisors that work very closely with all of our staff from the minute you join us to the time you are done with your orientation. Orientation in the OR for a nurse is approximately 7 months in duration. And this is led by our 2 clinical educators that we have in the OR. Orientation will consist of classroom education and clinical experience in the OR for you. You receive your training with your teams that I just spoke about, with at least 8 weeks being in your last team that you have chosen. So we give you the opportunity to go through all our service lines to see how things are run in the OR. And there you are assigned with a preceptor who you will stay with. We're in the midst of changing up our orientation program as well in order to fit the lifestyle of our applicants. So there you are paired with a preceptor. You will be following their schedule as well and just getting to integrate throughout the entire OR. You will learn in orientation the skills that you need to be a perioperative nurse, culminating with a focus once you're on your primary service team, whichever one it is that we just talked about. There you will spend 8 weeks finessing your skills. And you will be trained through orientation as a circulating nurse, and you will also learn to scrub. It's very exciting in the OR once you are scrubbing because we have so much education and knowledge and brain power in the OR. Our surgeons love to teach. And if you're scrubbing and you're seeing all these unique cases, you're right up there, you get to see what's happening, you see the anatomy, you can ask questions. It's a wonderful learning environment. So our teams are made up of nurses and surgical technologists. And these can range from smaller teams to bigger teams, depending on the service line that you are going to join. They're very tight teams. As we've kind of talked about already, they become very close to one another. They socialize outside or work with each other, but we're very team-based. We work together for success. We incorporate the cultures of Nebraska medicine in order to really be successful in the OR and have good outcomes for our patients. I would say our supervisors have been key to a very big success in the OR. Once you join the OR, you immediately start establishing that relationship with your supervisor. We also have service line coordinators who work in tandem with the supervisors to help with the education, to help with the skills. So we meet weekly, we meet monthly, you meet with myself as well as you incorporate yourself into the OR. If you would love the opportunity to work in an energetic environment, we would love to have you on our team. And it's never a dull moment, and it's very, very rewarding. So consider us, please. Thank you.
Thank you so much, Suzanne. That was very informative. Next, we have Meg and Melanie from Bellevue Medical Center and their Med-Surg unit.
Good morning, everybody. I'm Meg Cordes, and I am really feeling blessed this morning to present with not only Melanie and talk a little bit about Bellevue, but also with the other amazing leaders that are here with us this morning. I think any choice you would make, I've been at Nebraska Medicine for many, many years on main campus, and then most recently at Bellevue Medical Center. I think any choice that you would make at Nebraska Medicine is a good choice. But Melanie and I are really excited about talking a little bit about Bellevue. We feel like it's a little hidden gem down off of 25th and 370. We are a medical center that is affiliated and part of Nebraska Medicine. So we're supported by our amazing recruiting team that we're here with today. Policies, procedures are the same. Obviously, there's some things that are specific to Bellevue being a little smaller community hospital, but we love being supported as Nebraska Medicine as an entity. You'll see on the first slide, we like to tell everyone Bellevue is very, very unique. You saw the photo on the first slide that of the kind of Superman picture. We're very proud of that. I'm sorry, I didn't mean to have you switch between the slides. I apologize. We're really proud of that. And I think it's reflective of the innovative care that you can and experience that you can have being a nurse at Bellevue Medical Center. This picture was presented to us. It's kind of become a staple of Nebraska Medicine, but it was actually presented to our team, our Med-Surg team at Bellevue Medical Center for the care that they provided to a COVID patient when he was admitted. We have his permission to share the photo. It's kind of been lots of leaders and individuals have a print in their office. And most recently, we're excited that there's t-shirts that have been made. So we like to brag about that just a little. You can go to the next slide. Thank you. So again, you'll see our mission, our values. Everyone has spoke about those. We also really incorporate those into our team culture at Bellevue Medical Center. We're very proud of our team, and I think everyone in the organization really has a heavy focus on those values. You go to the next slide. So a little bit about the Med-Surg unit. Again, I think it's very similar to a lot of what Marla described on 4 and 5 lead, which is really, I think, a really great point, because a lot of standardization happens at Nebraska Medicine, which I think makes it so nice and so easy for any new staff members coming in. Whether you're choosing the Med-Surg or the operating room, a lot of things are very standardized. Some things that stand out at Bellevue Medical Center is, again, that small community feel. We have a wonderful opportunity there, again, to care for a diverse population of patients, medical, surgical, cardiac. We're a certified chest pain and stroke center. We're very excited about that. And then again, although it's a small community feel, you will gain valuable experience. And we really are very, very proud of that. One of the things we really like to comment about is our parking. If you've ever been to our main campus, although it is amazing, parking can be a little tedious. So our parking is close and it is also free. And again, if you live in the area, I think it's also something that is really, should be something that you consider as a valuable choice in your career. You'll immediately feel at home, that little community feel, friendly faces, everybody knows everybody. And it really is a wonderful feeling to be at Bellevue. Go to the next slide. This is an example of all of our rooms. Melanie's going to kind of go in detail into what the units do, but we wanted to give you a visual of our rooms. They're really beautiful. They're all private. The hospital itself is about 11 years old. We have all state-of-the-art equipment. We offer a lot for our patients. There are, all of our rooms are private. They're all wheelchair accessible bathrooms. There are, the 3rd and 4th floor is our med-surg unit, and there's 36 beds on each floor. And again, you would have the opportunity to care for all different types of patients. Next slide. I'll let Melanie tell you a little bit about our unit and some of the unique opportunities there.
Thanks, Meg. Good morning, everybody. So our med-surg unit is, like Meg said, on the 3rd and 4th floor. We have 36 beds on each floor. Right now, they are not all open. We're currently working on an expansion project to get them all open. So we go to a census of 52 between the 2 floors. Our supervisors are scheduled every day. They're kind of directing traffic, assigning those patients to whatever floor they're going to go to, and keeping track of all of the admissions and discharges. We, just like Marla, have that supervisor structure of leadership. So we have 5 supervisors on our unit, 3 day shift supervisors and 2 night shift supervisors. They're all amazing, very skilled in what they do and their knowledge and support that they provide to our team. For staffing ratios on days, it's very similar to Marla's unit. We have kind of a standardized matrix that we follow. So our day ratios for nurses are 4 to 5, and then nights, it's 1 to 5 to 6. We have lots of support. We have that nursing assistant support as well. And then we also have swoop RN. The swoop nurses are scheduled from 10 to 10:30. And they do exactly what their title says. They swoop in and help however they can. If you need help with placing an IV, help with a discharge, you have another admit coming up, they can help you with all of that. So they just kind of float around between the med-surg, the ICU, and the ED, and they help out. Our training, like Meg said, is standardized in the organization. So the med-surg units is just about the same. We have 7 weeks of orientation for our new grads. There's lots of specialized learning opportunities that's built into that first year of onboarding. I know that we're going to discuss the nurse residency program. Erin's going to talk about it a little bit later on. So I won't get too into detail about that, but it's an awesome opportunity and really helps you become that more experienced nurse and that experienced critical thinker. We also have a mentorship program on our unit. As soon as you're onboarded, you are paired up after answering a few questions. We try to pair you up with somebody that you kind of have things in common with. And so that whole goal of the mentor is just to have somebody that you can reach out to for a little additional support outside of your preceptors, outside of the NPDS that you're working with. Ashley's our med-surg NPDS. So the mentorship program, you can get as much out of it as you want, as much as you put into it. So if you want this person to go to coffee with you outside of work, or if you just want to keep it a work relationship, you can do that too. So we feel like ever since we've kicked off this mentorship program, that it's been really great and added support for our new staff. You can go to the next slide, please. So like all the other units, we like to do really fun activities. That picture on the left is some of our team. When we received that photo, it was, or the painting, it was really, really a nice team boost. Our team was very appreciative and just kind of overwhelmed by the feeling that they got from receiving that photo. So it was really, really nice. The upper right picture is just some of our day shift team. After we had a patient who was there for a little while on our unit, we were able to send him off and get him set up for life outside of the hospital. So it was really great. And then that bottom right photo is part of our leadership team that we have. So like all the units, our units are like family. You develop those bonds. You have to have that teamwork approach. And so it's an awesome unit to be on. You can go to the next slide, please. So again, this is just a picture of our beautiful facility that we have. Nebraska Medicine is, Bellevue is just that little smaller community feel. And so we would love to have you consider our unit as well. Thank you.
Thank you so much, Meg and Melanie. And next up, we have Erin Jordan to speak about the nurse residency program for new graduates in Nebraska Medicine.
Thanks, Ashley. I'm Erin Jordan. My title is Professional Development Supervisor, or NPD, maybe the acronym that you've heard throughout this presentation. My group that's pictured below, our group of NPD specialists or clinical educators, if that's easier to remember. We support the nurse residency program. We support all new orientees, new hires, new graduate nurses throughout the organization. The nurse residency program at Nebraska Medicine has been around since 2002. In 2009, we went from more of a homegrown program to a national program with Vizient and AACN. The important part about this adopting into the Vizient program is that this is a national program that's built off a curriculum that over 500 other hospitals use. So there are hundreds of thousands of new grad programs or new graduates within the same program. It's an awesome program that is meant to support the new graduate nurse through your first year. The program itself is led by my manager, Kaylee Guinan, and myself. That's roughly about 2 hours of being in a large group so that you get to experience the other new graduate nurses that are at the Nebraska Medical Center and at Bellevue Medical Center. So we gather together. Currently with COVID, we've been doing a lot over Zoom, hoping very, very soon to be able to get back into person. We gather together so you can have that camaraderie and that support and see that even if you're on 4 and 5 lead and you're talking to someone at Bellevue Medical Surgical Unit, you can see they're having the same type of experiences and sometimes challenges and really build that camaraderie and support. The small group time, that's usually the second half of the residency sessions, is with your small group facilitator or your NPD specialist. Or it might be someone from a like unit that is facilitating that small group. And that's when you can get into groups of 5 or somewhere between 5 and 10 usually, and talk about what's going on in your areas, work on what Melanie referred to as that quality improvement project or EBP project or innovation project, which I'll talk about in a second. So really it's meant as a support program to provide you with high level information. The other portion of the new graduate program itself is that fellowship. So almost everybody goes through some sort of fellowship. There's a medical surgical fellowship, cardiac fellowship, oncology fellowship, ICU fellowship, and that our NPD specialists also facilitate. So the nurse residency program is meant to give you high level information on the topics that affects everybody. And then the fellowship is going to train you for that specialty area that you are a part of. And so it's more of, this is about the skills, and this is about the overall content of nurse residency and what all new grads go through. If you can go to the next slide, please. So this is, I know it's a little hard to read, but as you can see, the program is roughly 12 months. So we don't start the day you start at Nebraska Medicine. It might be 2, maybe 3 months later, depending on when you start the program. We have 3 nurse residency cohorts each year, and that coincides with graduation dates. So those who graduate in May, we have a July nurse residency session. So that allows the May graduates, most of the majority, to come through the doors and get their NCLEX passed usually first, come through the doors, kind of get oriented to the unit and get those orientation classes initially done that first kind of heavy week with 1-chart classes and whatnot. And then a month or 2 later, we have them come to nurse residency so that they feel a little bit more stable in what they're doing before we introduce something new. In October or November, we have another group, and that's for the July and August graduate nurses. And then in March is our first or last group, however way you want to look at it, from the December of that previous year's graduates. So we have a group in March, a group in July, and a group in October or November. So the group that just started in March, and then we'll have a new one come next month, is our Shamrock group. We are color coded. So we usually come up with these random different titles for colors. And so as you can see, it's 11-month program, but you've already been at the organization for a month or 2. So we really are supporting you through your full 12 months of the first year of your of being a nurse. So we talk about the overview of the program. We talk about stress management, because that's probably what you're dealing with at the moment. We tend to go more of a, this is what you need now. So in your second month, we talk about what I refer to as the shuns, the TIONSs, the communication, delegation, anticipation, prioritization, the things that you're starting to learn as a nurse who has a full load of patients on your own, and delegating to our CNAs and others that you were working with on our unit. We talk about the EVP or innovation project, or it can be a quality improvement project. The project is a core part of the program that's integrated into each month. So I understand most of you as new graduate nurses have taken an EVP course, maybe done an EVP project. And so your first thought is, I have to do another one. And the purpose is because we want you to get involved in what's going on in the unit. You can partner with your unit-based councils, UBCs. You can partner with your quality champions. You do it as a group, so you're not alone. And the idea is that you're going to find something that's going to be passionate, and that it's maybe a challenge or something going on in the unit that you can assist with. And so it's going to be good for you. It's going to be good for your unit, and something that you say, this is part of my practice as a nurse now, as a new graduate nurses. This is something that I can help own and I can help improve. And that's really the heart of the EVP project. We talked a little bit on month 5 and 6 about resiliency, because in a second I'll show you that's kind of where nurses start feeling that I'm off orientation, things are not quite perfect in nursing and in healthcare, and it starts to weigh on them until they learn how to kind of build up that resilience and figure out how to deal with it through mentorship and through other people, and move on to this is this is how I'm going to function as a nurse, and this is how I'm going to be a great nurse. We talk about towards the end more of ethics, end of life, more things that we probably don't want to address in the first part of the residency program. Before we send you off on graduation, we talk about professional development and how you can continue to grow yourself. So these are all just pictures of our facilitators in our different groups, and we're just a very fun and very supportive group of NPD specialists that are available in each of the areas that you'll be on. Go to the next slide. So as I said, this on the left-hand side of this graph is how you're feeling. We usually come into the nurse residency as a new graduate, you're excited, you get to finally use that license, and you the last couple of years you've been studying, you get to put into practice, and you're getting paid to be at the hospital, not paying to to go to the hospital and do clinicals. And so, you know, you kind of waver on, I'm really, really excited. Oh, wow, I'm really nervous because I'm learning a lot of stuff that I didn't know in clinicals. And that's kind of like the bouncing line at the very beginning. The bottom are your months. So month 0 to 8+ months. As you can see, that month 5 or 6 that I described is a time where nurses, that weight starts to kind of weigh on them. We call that reality shock, and that's a documented thing. Even people outside of nursing feel this as well. So this is not just something that occurs with nursing and healthcare. What the nurse residency program is meant to do is not allow you to get into that depression and crisis mode where you feel like you want to leave the profession. We want to support you. And so that's why a lot of the times we talk about resilience and self-care towards 5 and 6 months. And that's also the time where we might hear residents say, well, why is this a year-long program? And this is why it is. Because if we don't help you through that 5 or 6 months, it could mean that we lose you, or the profession loses you, or we're not able to help you build up a support system that we can support you through the difficult times that sometimes a lot of our graduates feel. So again, that nurse residency program is just meant to help you support through that process and get you to figure out, hey, this is how I'm going to grow as a nurse. This is how I'm going to function and really thrive as being a nurse. Yeah, you can go on. And if you have any questions, again, I'm Erin Jordan, and you're welcome to reach out to myself, or Ashley can point you in the right direction if you have any questions about the nurse residency program.
Thank you so much, Erin. I have some time set aside here now for any questions that anybody might have up to any of the presenters or about Nebraska medicine. So feel free to put those in the Q&A function if you have any questions. And to kick it off, I did have one question. Erin, you had mentioned the fellowship programs. Do any of the units that are here today, do you offer any fellowship programs for your new graduates? Erin, do you know, or any of the managers that could share that with the group?
Absolutely. So a few years ago, our medical surgical NPD specialists, our educators, put together a medical surgical fellowship. So along with nurse residency, that's something you would be going through with their first year. As I said, the nurse residency is more high level, things that affect almost everybody at an organizational level, and doing that EVP project. And then the fellowship is more about, how do I care for a patient that may have psychiatric issues or mental illness? How do I care for a patient with endocrine, diabetes? Those are just 2 of the topics that of the 6 or 7 they cover in medical surgical fellowship. So actually Marla's 4-5 lead group and Meg and Melanie's Bellevue group, they're in the same med surg fellowship that they kind of band together and teach all of those. In the OR for Suzanne's group, your whole orientation is essentially a fellowship because it is a lengthy fellowship. So all those classes and orientation experiences that Suzanne put together is really an OR fellowship that they have created.
So the fellowship classes, is it like a Zoom or an in-person class, or is it self-guided?
Most of it is either Zoom or in person. For the most part, they want to do in person, because there's usually skills that they want to cover. Our cardiology group, they get to dissect pig hearts, that kind of cool stuff that we can get you thinking about the physiology of what's going on. And so it's really meant to be Zoom or in person, just depending on how things are going and the size of the group currently with COVID.
Great, thank you very much. Were there any other questions over any of the units we discussed, or again, about Nebraska medicine as a whole? Okay, well, if you would go to the next slide, I have the contact information here for all of the presenters as well as myself. So please feel free to email any of us if you have questions or would like to discuss more, and we can
get those answers for you. And if you decide that you would like to apply to Nebraska Medicine, we can go ahead and help you through that process. Like I said, this was recorded, so we will be able to send this out to you if you would like to rewatch any portions of the presentations today. Thank you all for attending, and have a great rest of your Saturday. Thank you.